Good morning, everyone. Welcome back those who are joining us here from day one, and welcome to those who are here to experience the lectures we're gonna have today. Thank you especially to those that are watching online through Zoom or YouTube. This morning, we welcome Dr. Friedrich Feuerhake from Germany, a leading figure in digital pathology and computational histopathology. His lecture on AI in pathology will show us how algorithms are transforming the way we study disease at the microscopic level, from improving tumor analysis to enhancing diagnostic accuracy. Today, he will also be joined by Jens Niemann, an informatician who developed the teaching platform that will be presented as part of his bachelor and master thesis. Please join me in welcoming Professor Friedrich Feuerhake and Jens Niemann.
Thank you very much. Thank you for this kind introduction, and thank you for giving me the opportunity to contribute to this amazing summer school. I would like to start with a short image from the science of digital pathology, and I would say that computational digital pathology is really truly an interdisciplinary science, reflected by many research projects that we have done together, concluded together. And so when we can do research together, interdisciplinary, I think it makes perfect sense also to teach and to learn together. And this is what we can do today. And I really appreciate the opportunity to share these ideas. Before we go into the aspect of teaching and learning, I would like to give, for those of you who are not so familiar with the pathology as a clinical discipline, I would like to give you a short overview what we are doing in the clinical context. We are talking today about surgical pathology, and the workflow behind it is basically the journey that the tissue sample will undergo from the operation theater all the way to our computer screens where we can analyze and extract information. Usually a biopsy or a resection is being taken and transported to the pathology department where we do a first assessment. This includes a macroscopic description of the tissue sample, and in many cases we also have to make first decisions about which part of the tissue sample will be diagnosed or evaluated in the microscope. We call this gross dissection. But of course, the whole sample is evaluated and assessed. The next step is embedding, because to produce images, we need to make the tissue somehow, to bring it into a form that we can section and cut into slices. This embedding can be done in different ways, for example, in paraffin. The sectioning is usually being done by microtomes. So microtomic sectioning can produce microns thick or micron thin slices of the tissue that can be then stained by different chemicals. A very common one is abbreviated H&E for hematoxylin and eosin, but many other chemicals are being used, and immunohistochemistry is a technique that is a little bit more specific and can, by using antibodies directed against specific proteins, we can detect specific structures, specific proteins in the tissue. Usually this is being done by automated staining, but it can also be done by classical lab work with pipetting. In the classical conventional workflow, we will then do a visual evaluation of the stained slides using microscopes. And what is basically the pathologist is doing is translate image information into a report. And classically, this report is a diagnosis, but many additional pieces of information are included that I will show in the next one. Wait, yeah. So first of all, it's important to remember that the pathology report is including multiple scales. So we are going all the way from the macroscopic description, and then we go in the microscopic scale with microns of distances, and even with a molecular level, we are going into molecular pathology, molecular scales. The pathology report, for example, of breast cancer can be quite complex. Understanding a pathology report sometimes is even for us as trained MDs a little bit difficult. For patients, they even need this kind of booklets, which is including like 20-25 pages, just explaining what is inside the pathology report. I've summarized it here for you on the right side. Histological type, histological subtype is usually what we consider to be the diagnosis, but many more information are inside. Like I will show you a little bit more what it will include. It starts with the histological type, the origin of the tumor, the organ and the tissue of origin, which is very often subtyped. And the next level of information is then the grade. The grade is basically telling us how malignant the tumor is. So the grade of malignancy and the spread of the tumor, which is commonly referred to as staging. That means how far is an invasive tumor already spread into locally or into distance localizations. It is also important to consider precursor lesions. That means non-malignant lesions that are not yet really, frankly, malignant, but nevertheless are important. This is, for example, in the case of breast cancer, very important because we have to report accurately the distance of the invasive carcinoma to the resection margins and not the distance of the precursor lesions. So a lot of information inside a report. And beyond that, there's also some associated data that can be very relevant if you would like to analyze automatically by AI image data from the microscope. For example, there may have been diagnostic interventions before the tissue is even taken out. You see here a roundish hole in the middle of the tissue, which is reflecting a biopsy that had been taken before the whole tissue or the whole tumor was resected by a surgical intervention. Another example, which is also important, is the journey of a patient over time. For example, the initial biopsy of a breast cancer specimen can look different from one that is under treatment or even after treatment. Here, what is reflected is the response to therapy, what we call regression, or consecutive inflammation in reaction or in response to therapeutic intervention. All these things somehow are summarized and concluded in a pathology report. The structure of pathology data in general, and specifically also for digital pathology data, is like I show here. Let's say a hypothetical patient, and in his history or in her history, there may be different interventions. For example, if we go back to this example of breast cancer, it may be that the initial contact with the pathology is the resection of a primary tumor. This tumor may have been sectioned in different specimens, which is representing the core, the margin, and maybe more tissues that are relevant. And a lot of data is then collected and somehow collated into this final report. There may be a second intervention, for example, the biopsy of a suspicious distant lymph node that does not contain, luckily, does not contain any tumor. And many other data can also be important, for example, medication. So the previous medication can influence the image that you see in the microscope. So let's now go into the next level of complexity, digital pathology. The breakthrough or the technological development that is most important is the scanning of whole slides. So we can reflect the whole slide that we have in the microscope in a digital image. For this, we need an appropriate infrastructure, which is including much more than only the scanner. So that is for sure. It needs to have the whole infrastructure. It is an additional level of quality control that is required because it is not only the quality control of the sample journey now, but also the quality control of the scanning and the data management process. And if we talk about AI and deep learning, additional pieces of infrastructure are important. For example, the hardware requirements and the quality control of these underlying algorithms. This is very important to know. The whole slide image is more or less an image pyramid. I think the informaticians among you are very familiar with this concept. The complexity is maybe that different scanner providers or manufacturers use different formats. It may be tiles or stripes, and they may also be using their own proprietary formats for the images. But it's very similar and can also be transferred into each other. And the different levels of resolution are basically associated with a different conventional concept of magnification, which is we are using different objectives in the microscope that we call 40x or 10x or appropriately lower magnifications. So that is the technical base of that. And the clinical implementation of digital pathology is yet another step. This is more than just the technology or the scanning and the image management, but it's also now going into the analysis of image data. So the clinical implementation of digital pathology requires concordance testing because the state of the art, the guidelines, the clinical guidelines that we have to follow are relying on the visual assessment. So first of all, we need the concordance testing and to make sure that the digital assessment is at least not worse, and in the best case better than the visual state of the art. And quality control is then in the hospital setting also a very important issue because we have to integrate the whole digital workflow into certifications, accreditations. So the clinical implementation is quite a long journey, and it takes, there were some pioneers in Europe. It was the Netherlands that were really first, Utrecht, and also Spain in Granada were the first fully digitalized pathology departments. There are other pioneers that have been working with this technology for quite a while. And we see now really emerging clinical use of digital workflows. But for AI, which is the topic today, the image is a little bit less clear. So the AI algorithms can, of course, help a lot to provide decision support and quality control. But I put it in gray here because the integration into clinical workflows are yet to come or emerging, I would say. Let's have a look at the situation and the potential that we have here. In principle, there are two ways to use AI in digital pathology. One is very task specific. So we do basically everything that I just explained you here on is summarized here on the left side of the image. And I won't repeat this. And then we have a specific task. Let's go back to our hypothetical patient, and we would like to analyze this suspicious lymph node. So the question now of this second intervention is, there is a swollen lymph node somewhere distant from the primary tumor, and we have the suspicion it could be tumor, and we want to exclude that it is somehow involved in the malignant disease. So then we have to cut this lymph node or this biopsy, and the task is find any little very tiny piece of tissue, even if it's only 1 or 2 cells. This is something that AI is very good at. And there have been competitions, international competitions on lymph node assessment in this context, very successful. And this is basically the handcrafted approach where you really say, okay, I have one specific task to detect a mitosis, so cell divisions, to detect the malignant part of a tumor, or to see whether a lymph node contains tumor or not. This is very task specific. We have also more black box approaches where you basically give in the whole image and you would like to have an overall output at whole slide level, which means you can basically ask AI to do the diagnosis, to classify a full slide into a disease. Of course, this is much more complex, but it's also being done, and it's we are getting also closer to workflows, successful workflows that work like this. However, this is much more explainable and of course much more, let's say, accepted by medical professionals, because we can basically control the performance of the algorithm a little bit better than here, because here we don't see which criteria, which features have been used. I will now show you one example from my own clinical work. So I'm a neuropathologist, and therefore I'm mainly involved in the analysis of brain tumors. So what can AI do? I can tell you it's amazing. It is absolutely surprising how good that works. You see here the workflow. This is my work, my everyday work. We we get a sample that looks like a adult-type diffuse glioma, and then we have to do several tests, which are molecular and immunohistochemistry. In the end, we have to classify this glioma in different types of malignant glioma. And this work has been done partially or in whole by AI. It's amazing to see how well and how frequently this has been done. We have several publications over time from 2015 until now that are dealing with this topic. Survival prediction is one endpoint. So then the researchers would like to predict the overall survival of the patient based on an AI algorithm, which is very challenging. I won't comment on the success, but I would like to let you know that this is possible. The molecular marker prediction is very interesting. So basically, the AI algorithm is able to predict whether a tumor, for example, has a certain mutation or not. In this case, IDH1 wild type or mutated. And I just explained in the beginning of my lecture what subtyping and grading is meaning. So this is also something subtype and grading can also be predicted. This is very, very interesting. It is amazing how well this works. This is an overview just to see which approaches have been used for that, without going into too much detail here. And then I would like to go even to the next step. You see, we have reviewed the state of the art basically last year, and then in the beginning of the last year and also in spring, then there were a couple of very I would say intriguing, groundbreaking publications on foundation models in digital pathology, which were very impressive for the field. I will only show you two of them because they have been involved directly in brain tumor analysis. And you see here that very, very high case numbers and very high numbers of images have been investigated. And there's a surprising accuracy actually to predict the overall diagnosis, which is the tumor subtyping and tumor typing based on AI with that. This one has been, I think, this model has been developed in collaboration with Microsoft. And the other one, which is also notable, is called Uni. It's very frequently cited now, and it's used as a kind of benchmark and reference for many people in the field. And this is also interesting because I'm just magnifying this now here. We have also a high number of brain tumor slices, and the accuracy of the diagnosis is, for me, as a neuropathology, surprisingly high. So this is very promising, and I think I can easily talk about the potential and the perspective of AI in pathology, no question. But now we have to look a little bit into the details. It is important if we think that we as medical doctors will use algorithms like this for decision support or for accuracy control. I think we have to know how these methods work. And what I see, at least in my teaching activity and in my clinical work, and when we talk to young residents, I think what is missing is this kind of interdisciplinary knowledge. So in other words, the MD people are not so good at understanding how these algorithms work and what are the potential and the limitations. And on the other hand, as I pointed out in the beginning, we have been collaborating with informaticians and mathematicians and many other computational scientists for a long time. And I realized that it's really important that also they understand a little bit better what pathology really means and what is the base of the images that we are dealing with. So for this reason, we decided to go a little bit into this teaching and learning topic. And over the years, we have done both at the same time. I would say we started research with a crowdsourcing project and some other interesting topics in the field, and at the same time developed a course here at MHH so that we can jointly teach it. And luckily, Thomas Deserno was enthusiastic enough and visionary enough to collaborate with us here, and to jointly we were able to set up a course where really the informatics students and the medical students are really in one room, or at least in the virtual room. And this is something that I appreciate very much, and I enjoy also the teaching in this interdisciplinary setting. And the other lucky fact is that Jannis, who is here in the room, was also interested in this as an informatician, and created the software that we needed to perform this kind of joint teaching course here between the two disciplines. And with that, I would like to hand over to Jannis and just change the slide so that you can maybe explain a little bit from your informatics perspective how you were approaching pathology. You're still mute, but it's a bit difficult to find. Oh, we could hear you all the time. Why are you so mute? Okay, let's give it a...
Oh, okay. I also had to unmute me. So hello from my side. So yeah, I'm a computer scientist, and I developed the software Pathology. So I had hands-on experience on working with medical experts in the field of pathology. And I would like to emphasize the importance of collaboration between those two groups. So when we develop software normally, and we follow a very linear path. So we define some specifications, implement these specifications, test them, see that something is not working, we iterate and do it again. And at the end, we hand over the finished product to the users and they can use them. Well, in this case, I found that this approach is not very ideal for building software that will be used by medical professionals, especially in the field of machine learning. The reason is both sides bring different but equally essential expertise. So we have medical experts who understand what information is relevant in tissue images and which clinical questions really matter. Computer science, on the other hand, understand what is technically feasible, what data requirements exist, and how to train and manage machine learning models. If these two perspectives are kept separate, the results are often either not clinically useful or not technically feasible. Instead, what is needed is a process with multiple iterations of discussion and feedback. For the medical side, this means gaining insights into the possibilities and limitations of machine learning, understanding what is essential for the success of machine learning models, and keeping this in mind when collecting data or using machine learning models in practice. For computer scientists, it means acquiring domain knowledge in order to better understand the data and to refine machine learning models tailored to real clinical use cases. Now, creating and training machine learning models usually requires both programming skills and substantial computational resources. These challenges affect both groups. So we have the medical professionals who often lack prior programming expertise. Computer scientists have to think about managing hardware resources, different dataset versions, training the actual models, and providing the final models for inference and use in clinical application. So with the machine learning module in Pathology, we wanted to address this by providing a layer of abstraction on top of the hardware and programming. It does it by providing a node-based approach. As you can see on the image, instead of writing code, users connect visual building blocks or nodes to design the entire training process. Each node represents one step in the workflow. For example, the data set, data pre-processing, defining the model, training, and evaluating the model at the end. This has several advantages, especially in teaching scenarios. For example, for medical students, it lowers the entry barrier. They can gain their first-hand experience with machine learning, experiment with parameters, and immediately see how changes affect the outcome without needing to be programmers. For computer science students, it allows them to design and test more complex models more quickly without worrying about hardware constraints. At the same time, they can observe how medical expertise fundamentally shapes the workflow. So to summarize, it is essential to collaborate between computer scientists and medical expertise to iterate on new insights and create mutual understanding between medical and computer science matters. So, and Jan is going to explain his experience on Pathology and present more challenges that exist with using machine learning in pathology, especially.
Okay, thank you so much, Janis. Again, it's not only a pleasure to work with you and do research, but also to present. Thank you very much. And now I would like to start with the, well, I have to see. We have a live demo. We have Jan. Jan Weber is a medical student and one of the first participants of our course. And he is so kind to show us a little bit hands-on how this tool works. Jan, can I hand over to you?
Yes, thank you very much for the kind introduction. So I have a medical background. I'm a medical student, but I also work in the research group of Professor Feuerhake. So I'm also involved in quite a lot of data science. So I just want to visualize the challenges which arise from the collaboration between medical and informatical expertise. So for that purpose, I would like to present a practical example of a project which can be generated in Pathology. In this case, we want to investigate a classification of breast tissue in malignant or non-malignant. So first of all, we need a data set for machine learning. And we here have extracted a data set of about 4,000 images from breast tissue slides, which were stained with H&E. And we have more malignant and non-malignant slides. For example, here we can see cancer growing in this stromal tissue, which is a clearly malignant feature. And we can also see more benign cases, such as here. It's only stroma, we don't have cancer cells here. And we want a model to classify those two classes and to discriminate between them. But we need to take care that there's one important limitation in application of AI in digital pathology. Professor Feuerhake just mentioned that we have full slide images, but those images are rather large. So they might contain more than 100,000 pixels in each dimension. That is too large for our AI-driven algorithms, which are more specialized on normal daily life photos with a few hundreds of pixels in each dimension. But on the other hand, we have a trade-off arising from that, because, for example, in this case, this image might be too small to actually see whether there is cancer or not. Those cells might be stromal cells or malignant cells. We don't know if we don't see the surrounding tissue. That is one important limitation. And also we need to know that there are different tumor compartments. So non-infiltrated stroma tissue and some parts are overgrown by cancer. So we can just take a grid and partition a whole slide into tiles and assign all them to the same label. That won't work. So there's a trade-off between taking sufficient tile size that can be processed by AI algorithms and capturing enough information for a meaningful analysis. And this containment of information, this is one task that can only be done by medical students or medical professionals. Thus, it is important to collaborate to have supervised data sets, which are the foundation of deep learning in digital pathology. In Pathology, we have a collaborative view to jointly work on deep learning projects. In this case, we can have a look on the most simple neural network we can build out of convolutional neural networks. Convolutional layer, pooling layer, and fully connected layer. In this case, we can just connect these blocks in Pathology and finally achieve a certain accuracy. Obviously, it's an informatic task to get to these accuracies and to maximize them. But our task is not ending here at these accuracies, such as the case in computer vision applications in many cases. But the mistakes done by such algorithms are sometimes explainable. Sometimes certain tissue patterns are not recognized well by the AI, and we need to take care to have appropriate training data sets. And maybe we can learn a lot from just checking the results by medical experts, how we can include different training images in the training procedure. And we luckily don't need to build every CNN from scratch. We also have pre-trained models which were trained on the images from daily life, cats, dogs, cars, humans, and we can train them for digital pathology purposes, and they are generalizing quite much better and faster than just training from scratch. But also in this case, we finally end up with certain accuracies, and that's not the point where we are allowed to stop, because we are finally aiming at improving patient outcomes and patient diagnosis. And for that, we need to keep in mind what Professor Feuerhake just mentioned, that one patient might have different resected specimens, and each specimen might contain different slides and different stainings. And each slide contains thousands of patches for which we made the prediction. So there's a lot of computational work to be done to unify all these results to a clear message what needs to be done with the patient for the best outcome. And this is again a task that requires again medical expertise and cannot be done by data scientists alone. And with this closing statement, I would like to yield the floor back.
Thank you very much, Jan. And I have to say, Jan is MD student, but I think he has an exceptional knowledge and previous skills in that usually most students of medicine would not bring into this course, which is of course very nice for us, and it facilitated the collaboration a lot. But please, and this is now to all the MD students in the auditory, please, you can really use this and work with this and get an approach to it without having a lot of previous skills in programming or computational science. So, I mean, you need a certain openness, open mind to it, but as the idea of this, and this is really thanks to Jan's work, is that it is a little bit easier to address it and to understand what you can change or what you can modify to improve or to change the performance of such an algorithm. So I think with that we can go back to the presentation. The idea, let me just find the full screen again. Okay, yeah. So I think it is clear now that we have basically what we have just seen by Yannis and Jan were the PathoLearn module 2, which is basically the idea to get an easy access for both people from the computational side and the medical side to talk to each other and to jointly solve a problem. And now we can go to the problem itself. As you saw, that one of the very important requirements for successful AI applications is high quality annotated data. And this is really scarce in pathology. One other intention of our joint course that we are offering is to provide medical students and also informatics students or computational students a little bit more with an insight into the difficulty and the challenges of annotating pathology images. And this is the PathoLearn module number 1, where we would like you as students to perform interactive annotations. And I was very happy to see that many of you participants did already try a little bit. So this is exactly how we were intending to use this. You just signed in and tried without any previous knowledge. And I think this is exactly how we envision this to be. We would like to learn to, even if the previous knowledge is not very deep, you can still start to think about how does the tumor look like, how does the normal tissue look like, and then step by step, of course, in our joint lectures. This is not only a matter that you can teach in 1 hour. In our joint University of Braunschweig, Technical University of Braunschweig and Medical School Hannover course, we are learning this in several steps and several lectures, and gradually improve the knowledge for both the computational and medical people. And here I would like also to go back to a live demo for you to make this a little bit clearer. And for that I have to go here. Okay, here I hope I'm sharing the screen. So if you go into the PathoLearn link, follow the link that I have shared with you on the Google Classroom, you can see basically 2 tasks that are important for AI. This is the cancer area delineation task and the cell center annotation. And I would like to go here first. This one is the view of that you see for the delineation. What you see here in brief, just to give you a quick overview, is you see here a big tumor growing. This is the tumor. And the tumor is a breast cancer of a certain type. And this is growing into the normal tissue, which is roughly here. What you see here, if you zoom in a little bit, is you see normal components of breast tissue. This is the normal lobules and the normal ducts of the breast. This is fatty tissue and connective tissue that is also pre-existing and normal. And then you see here the tumor. And again, this is nothing that we can learn in 1 hour, but at least I will tell you that the tumor cells look a little bit different from the normal cells. One difference is that they are not organized. So you see them like chaotically put together without any structure. You see mitosis here, as you see here. And if you compare that to the normal breast glands, here you see, we call that isomorphic. You see all the cells look more or less the same. They form nice ducts and structures. They are organized in a way. And then here you see ducts. It's a staining for basal cell. You see the lining of a normal duct that is within the lobule. And you see also the ducts, larger ducts here that are basically, built to transport milk during the lactation. And this is the normal tissue. Okay, so what you can do here is you can recapitulate, the medical students can recapitulate a little bit anatomy and maybe teach, actually, if you are in one classroom together with the people from the computational science, you can think about these concepts like organized tissue, disorganized tissue, pleomorphic cells, which means very different cells with large nuclei, and isomorphic cells, which are here, which are well organized and look all the same. Okay, so this is the idea of it. The task now, if you sign up, and I would like to, and would be very happy if as many of you would do that, is the task is to delineate the tumor. So without spoiling it too much, I can tell you that this is tumor here, and the task would be to draw a polygon around the tumor. And now we have some participants who did this. Actually, this was Jan, as far as I can guess from the initials. And so he did a great job. Unfortunately, of course, this is all in German, but you can, of course, translate. So that's not very limiting, I think. What you see here is with Jan's annotations, that the tumor is actually invading the normal tissue. You can see as far away as here, you see little pieces of the tissue. And this annotation exercise helps you actually to understand a little bit more. For example, you see here a little mistake, or it's not a mistake. You see here, richtig gelöst means it is all correct. So he has everything done right. But actually, when I did the annotation myself, the ground truth, I actually included this here. And so this is the reason why it's a yellow line. So we can discuss now about that. Is it correct to do it that way, or is it better to do one big tumor chunk? So this is between the teaching people and the learning people a starting point to discuss. But it goes beyond that. If you remember what I said about the DCIS, which is the pre-malignant form of the tumor. Let's just imagine that this is the resection margin here, and I have to describe the distance between the invasive portion of the tumor and the resection margin. Jan has correctly annotated here that this is not DCIS. So you see here that the lining of the duct, the pre-existing tissue, is not respected. The tumor is crossing the border, in other words. So it is the correct annotation here would not be the brown line, which is the duct's lining, but you see it's invasive tumor. So it is the concept of DCIS and the concept of resection margins can be learned here. Another application would be, I have to navigate a little bit, sorry. This part here, so I won't go into the same level of detail, I think. Here, what the background of this task here is to annotate single cells. The background is that many cancer therapies now are targeting the immune system rather than the tumor itself, or in combination, the tumor and the immune system. So the red cells here are killers. So those are the cells that are supposed to kill tumor cells. Unfortunately, you see only very few here. Here's the tumor, and you see only very few killers, unfortunately. For some reasons, the tumor manages to keep the killers outside. So here you see a lot of immune cells. The red ones are the killers, and the green ones are the helpers. So why are they all here and not in the tumor where they are supposed to kill the tumor cells? This is a matter of debate and the topic of immune oncology. So annotating is one thing to generate ground truth and to find the cell centers of the green and the red cells. But also at the same time, the idea is in our course, in our teaching sessions, to create software to identify these, to train a model that can distinguish patterns. This pattern, for example, is called immune excluded. And we would like the students to understand that this is a pattern, a spatial pattern that is reflecting a biological process. And here, I think that here you see the overall pattern, and you see the single cells that are here, very few ones in the tumor. And the idea of the course would be, or of this would be to, right, let me go back. I'm sorry, I'm not good at multitasking. I will, okay, no. So I would strongly encourage you to use this. I have already posted this in the Google Classroom, and here's the information again. Please register, follow this these little advice here, and feel free to annotate and to try and to play, I would say, as much as you want. We have only 1 hour for a lecture. Of course, this is not a seminar where we can discuss the results, but what I would offer would be that Jan and I will offer a short Q&A conference tomorrow. So after your lectures, unfortunately, it is conflicting a little bit with your program. I know, I'm sorry about that. If somebody finds the time and if somebody has some questions, please feel free to contact us, and we will discuss exactly in the way that I just showed. We will correct your potential mistakes and answer your questions. And the idea of that is we are using this not only for cancer, but also for example, for neuroscience. The idea is that you learn not only to solve a question, but you can navigate in the whole slide images. You can, as a medical student, you can recall preclinical and anatomical knowledge a little bit. For example, where is the hippocampus, or where is let's say the different structures that are important for Alzheimer's diseases, tangles and plaques, for example. So the nice thing is that you can get an immediate formative feedback, so you can improve a little bit. But of course, this is not meant to be an only online tool, but we would like to take this as a platform to improve our dialogue between teaching and learning people. So for example, in this case, sometimes we discuss afterwards, after the course, we discussed and said, okay, here the student was a little bit too fast. So he was okay, but it is a little bit superficial. But this student somehow forgot from the preclinical lessons that there's a connections between the two. There are connections, and they're actually very important, these connections between two sides of the spinal structures. And here we could say, okay, you have to improve your performance a little bit, but it's okay. And here in this case, we could say maybe you have to look into the anatomy book again and see, and just realize that there should be connections here. And this is how we would like to use this. We have evaluated a little bit this interdisciplinary teaching lessons. Most of the students, not all of them, but most of the students enjoyed it. And I can tell you from my side, I enjoyed it a lot to see that, and this is really thanks to Thomas Deserno, that we are really putting together two professions into a room or into virtual sessions and encourage them to solve a problem, more or less like maybe later on in your professional life when you have to write code or deliver some algorithms to solve a problem in the medical field. So with that, thank you very much for your attention. We are coming from crowdsourcing and basically from research on these annotations. And first of all, I would like to thank all of the students, and this year, who have helped us with their time and with their enthusiasm and with all their spirit, scientific spirit, to perform this and to bring this. And of course, Jannis, and in this case, as one of the first users, Jan, who helped me today to present this. Thank you very much for your attention.
Thank you so much, Dr. Friedrich Feuerhake, again for giving us a lecture on Pathology. Remember, if you have any questions while using it, tomorrow at 1 p.m. you can have a session with Dr. so you can answer all your doubts.
Exactly.
We have a question from the Zoom meeting,
Sure.
which is from Sarai de Leon. She asks, Pathology could be used by any medical doctor with basic programming skills, and is it open source?
This goes to Yannis.
So yeah, Pathology can be used without any programming skills. It just needs some understanding of how neural networks work and what parameters are available. And Pathology is open source. So yeah.
It is published as a master thesis, I think.
Exactly. And the source code is also open source.
Exactly.
Okay, thank you so much. So remember, you can use it and play with it so you can keep learning more on how AI and medical tools are being merged. Thank you so much again.
Maybe I should add one little thing. We have recently moved it, so it is fully functional, but we have recently moved it to another server. Actually, we are still working together with the French group of IQ at the University of Strasbourg. And right now, we have a little bit of hardware restrictions. So the Pathology AI module 2 is not fully functional. The prediction does not work, but we are working on it. And please feel free, if you would like to use it, to contact us, and we will let you know as soon as it is functional again.
Thank you so much again. This will be the end of the session. If there are no further questions from the public on site and online, thank you so much for keeping tuned in the meeting. And thank you, Doctor, and your students for such a wonderful conference.
Thank you very much. Have a nice further summer school. All the best from Germany.